And welcome. Thank you for joining us this morning. My name is Diane Stephen, and I manage the Small Business and Entrepreneurship Center, and I'm part of the Economic Development team. Also part of our team today is Jennifer Johnson. She's working behind the scenes for me today to make sure everything's working smoothly and doing any troubleshooting that might need to take place. I'm happy to be hosting this webinar today and to have our guest speaker, Richard Ocharovic, and he's going to share information on how the new provincial emergency and workplace safety measures will impact our local businesses, and to have the opportunity for you to ask questions directly for clarity. We will be recording this session today, and it will be available up on the City of Kawartha Lakes website. Just a little bit of housekeeping. I imagine most of us are now fairly familiar with the Zoom webinar experience, but I just want to request that you keep your microphones on mute during the presentation. This will help to cut down on the background noise. If you have any questions, I'm going to ask that you type them into the chat box. And at the end of the session, we will be answering the questions that were submitted in advance, and then follow up with those questions that we have that are collecting in the chat box. So Jen, if I could get you to please hit the record button, and I will introduce our guest speaker. So, welcome, and I'd like to introduce to you our guest speaker, Richard Ovcharovich. He is the manager of the Health Protection with Haliburton, Kawartha Lakes Pine Ridge Health Unit. Richard has been working in the public health field for 24 years and has been employed by the local health unit for the past 17 years as the manager of health protection. Richard is responsible for the food safety, rabies, and vector airborne disease programs, and that include mosquito and tick surveillance. So, Richard, I'm going to hand it over to you, and welcome and thank you for joining us today. And I'm going to stop sharing my screen right now.
Thanks, Dan. Thanks for inviting me to speak with the group. This whole COVID experience has been very challenging for
Richard. For some reason, we're not getting any audio just at this moment.
Is that better? Can you hear me now?
Yep.
Okay. Yep. I just got a new set of headsets, so technical difficulties. So as I said, I wanted to thank Diane and Carly and Jen for inviting me to speak with you today. As was mentioned, I have been employed with the HKPR Health Unit for the past 17 years as a manager for the program. And this is probably one of the toughest emergencies that I have ever had to deal with, as probably all of you have also experienced. So what I wanted to start with is just stating some of the legal changes that have occurred. The provincial government has issued a second state of emergency on January 12th, which requires all individuals to stay at home in order to be able to get the COVID-19 infections under control. We have seen a spike in the number of infections throughout the province as well as locally. And if you guys can recall, the color-coded reopening framework that we had in place, when we went into the lockdown on December 26th, HKPR Health Unit was in the yellow stage. If we were to look at where we are right now, we would be in the mid to high orange stage at the moment. So there is a significant need to follow the guidance that's been provided by the province and the local health unit to help reduce the number of infections that we have currently happening. So what does that really mean? What does it mean to stay at home? The province has identified a number of acts and regulations. So there's two main acts that are in play during an emergency, or during this specific emergency. There is the Emergency Municipal Civil Protection Act, which has a number of regulations under it. And then there is the Reopening Ontario Act that has the lockdown regulation 8220, which I'm going to be referring to through most of the presentation today. The regulation 8220 specifically identifies what businesses can and can't operate, and also identifies the restrictions while operating. So when we speak about when can a person leave home, an individual can leave home to go to work, school, or childcare, obtain goods or services, assist others, and these are to provide support to individuals who need it, especially those living in congregate settings, providing care for their elderly parents or children. Also, some health and safety legal purposes. So if an individual is in a situation where they have to leave because of their safety, they're being in an abusive relationship, those individuals are allowed to leave home. There's a lot of question about people leaving to go to cottages. And we've been fielding a lot of these questions. The direction from the province is that everyone is to stay home. The only time individuals can leave to go to a secondary residence is if they travel to stay in that residence for less than 24 hours, or if they're going to stay in that residence for more than 14 days or more. So the 14 days or more is more in line with the quarantining or self-isolating of an individual in one place. That does not mean that once you go to the cottage, you can visit and run around the area. If you're going to be staying there for the 14 days, you should be, for quarantining purposes, you should be staying in there and self-isolating. There's also an allowable travel between parents, guardians, and caregivers' homes. Also to purchase or to sell a home. And if you're moving from one area to another. So those are the restrictions that have been put in under the new EMCPA, or the Emergency Municipal Civil Protection Act, on when people can move around. To travel under that same act and the respective regulation under it means to travel to an airport, bus station, or train station traveling outside province only. So it doesn't mean that people are allowed to go from Toronto to city of Kawartha Lakes, or from Toronto to Haliburton County. There is the order is quite specific. It is worded in a way where there seems to be a lot of flexibility, but the Premier has been quite clear for individuals to stay home. I also wanted to kind of mention that the health unit has a team of professionals that are working now 7 days a week, doing a lot of the contact tracing and outbreak follow-ups, as well as our call center. So we are fielding a lot of calls, and we are providing information as much as possible to individuals that have inquiries. Same kind of inquiries have been fielded by all other enforcement agencies, whether it's the municipal bylaw enforcement agencies or the local police services. And those three agencies, the local health unit, bylaw, and local police services, are the ones that are in charge of enforcing the requirements of the emergency orders that are put in place. So there's a lot of questions on what businesses are allowed to remain open and what businesses should be closed. So I'll start with the ones that should be closed because it's probably easier to go through that. So all day camps are to remain closed. Public and private elementary schools return in person is January 25th at this moment. Daycares are open but prohibited from serving any school-age children until they go back to school in person. Before and after school programs are closed until January 11th and will resume when in-class resumes. And I find this information being specifically important because most of us are working. A lot of us have young families, so it has a direct effect on each individual that has young children. There's a new requirement for masking for grade 1 to 3. And there's a requirement for masking when outdoors, only if you're unable to maintain the 2-meter distance from other individuals. So that's schools. Meetings or event spaces are closed with limited exceptions. And those limited exceptions are childcare, court services, government services, mental health and addiction support services, permitted to a maximum of 10 individuals at a time, and the provision of social services. For restaurants, bars, and nightclubs, they're only allowed to operate under takeout. All of those facilities require, and all businesses now that are in operation require safety plans to be in place. And these are COVID safety plans. And as I mentioned, in dining, indoor or outdoor is not permitted. All personal service settings are closed. So this includes barbershops, hair salons, manicure, pedicure, tattoo, body piercing, all of those services. Retail sales and rentals. This is a lot of, we receive a lot of questions on what's allowed within retail, what's not allowed. So the retail sector for, let me just find this. I apologize for that. I just lost my. So there's certain stores like the big box stores and discount stores that are allowed to operate with 25% capacity indoors. There is grocery stores, supermarkets, and other food stores that are allowed to operate with 50% capacity. This includes the big box stores as well. All other businesses are supposed to be operating curbside or delivery with delivery provided. Pharmacies are open in-person retail with 50% capacity as well. Other retailers such as gas stations and other fuel suppliers are permitted to operate. Safety supply stores, businesses that sell, rent, or repair assistive mobility devices, medical devices, optical stores. They're also allowed to operate by appointment only with 50% capacity. Stores that sell liquor, including beer, wine, and spirits, are allowed to operate with 25% capacity. And they have a time restriction in there as well. So between 7 o'clock and 8 o'clock in the evening, or 8 o'clock in the morning and 7 o'clock in the evening. Garden centers and nurseries, curbside pickup only. Malls. Malls are open from 7 a.m. till 8 p.m. No delivery of goods outside of these hours is permitted. And in-person shopping is also not permitted. So the only thing that the malls can have is for businesses that have entry to the outside. You can have people shop through curbside. And in the mall, you're allowed to have one spot for people to be able to pick up their items that they have purchased. There's also an allotment for outdoor, up to 2 outdoor spaces where items that have been purchased can also be picked up by the clients. At all times, all individuals need to ensure that they maintain their 2-meter distance. If they're going to be indoors, masks are required. Outdoor recreational facilities, all ski hills are closed. Team sports are not permitted for practice or play. Locker rooms, showers, change rooms, and clubhouses are also closed. Entertainment, concert venues, theaters, cinemas, they're all closed. And that includes no drive-in or drive-through events are allowed at this point. Casinos, bingo halls, gaming establishments are also closed. Boarding kennels and stables are permitted to open or operate. For animals, owners and their respective representatives to visit the animals, they're allowed to visit. Although boarding kennels and stables are allowed to operate, pet grooming is not allowed to operate at this time. All driving instructions in person are not permitted at this time. Hotels and motels are permitted to operate. So this is hotels, motels, resorts. They're allowed to operate. However, there is a recreational and other shared facilities must be closed. And once again, we have to go back to my initial statement on the allotment for travel for individuals. So even though hotels, motels, resorts, and other facilities other than shared accommodations are allowed to operate, the traveling public is restricted. Short-term rentals are closed except for individuals who are in need of housing. And the short-term rentals, these are B&Bs and those kind of accommodations. Libraries are allowed to operate through curbside delivery and pickup only. Museums and other cultural amenities are all closed. All motorsports are closed. Photography, commercial and industrial photography is permitted. Retail photo studios are, however, closed. Real estate is permitted to operate property showing by appointment only, and no open houses are permitted at this time. All tour and guide services are closed. Ice fishing was a big one. Ice fishing is now permitted, but it's permitted for local area residents. So there should be no interprovincial travel from people from other jurisdictions coming into a different area to go ice fishing. There is a possibility for tickets if we receive complaints, and either by law or police services identify that the individual has traveled for non-essential business. With respect to the ice fishing, hut rentals are permitted. The capacity limit is up to 5 individuals from the same household, and they must be able to maintain proper distancing. It is strongly recommended that all individuals, while renting before renting the ice huts, be screened. With respect to construction is permitted for certain projects, that are in line with healthcare sector, long-term care sector, including facilities, expansions and renovations, projects regarding some provincial and municipal infrastructure, including transit, transportation, energy and mining, schools, colleges, universities, child care centers. Also, all construction that has been initiated before January 12th. So construction projects that were commenced before January 12th, and that would provide additional capacity for businesses that provide logistical support, distribution services, warehousing, storage, shipping, etc., are allowed. For residential construction projects, where a footing permit has been granted for single-family or semi-detached or townhomes, and the project is a condominium, mixed use, or other residential, and the project involves renovation to residential properties and construction work has started before January 12th. So I'm going to leave it at that for now, and we can go to some of the questions. That is generally the main point of the Regulation 8220 and Regulation 11 under the MCPA. So 8220 is under the Reopening Ontario Act, and Regulation 11 is under the EMCPA, Emergency Municipal Act. So maybe Diane, what we might do is get you to read some of the questions, and I'll try to answer them to the best of my abilities. If I can't answer your question today, I will get an answer for you, and I'll forward it on to Diane or Jennifer, and those answers can then be forwarded back to all participants on this call.
Okay, I'll start off with the first one on my list here is, will concrete ready mix production or delivery be affected, such as to construction sites and home delivery?
Yeah, that's a good question. And as I just mentioned, with respect to the construction, as long as the construction projects are ones that fall within the construction section that I just read, and I just skimmed through it. There's some additional points in there. They would be allowed to operate. It is an essential service.
Great. The next one I have, stay at home, but can get together in a group of 5. It's confusing. Can you explain what this means?
So the stay at home is pretty clear. You stay at home with individuals of your household. The group of 5 is for outdoor gatherings, and it's been put in there to allow people to get out and still maintain relatively healthy living, clear their head, and get some exercise. So you are allowed to use the trails for walking. You're allowed to go tobogganing with your kids. If you're going to be going into an area where there's more individuals, uh, the point is to stay within a group of 5 of your own group and maintain your distance. But the focus continues to be to stay within your own family unit or family circle that you have.
Okay, all right. Here's a question regarding clarification on masks in the workplace. We do have members of the public accessing our facility. In common areas, everyone, including staff, members, guests, visitors, are to wear masks. We are wondering about those staff who are working alone in private offices or in a space where they are socially distanced. Shared office space with social distancing is one question.
Yeah, and that's another very good question. So the province has strengthened the requirements for masking, but we still need to apply some common sense to it. If you're in your own office and there's nobody else in there, there's no need for you to wear a mask. If you go out of your office to speak with another individual, it's required that you put a mask on. If you're uh, uh, in an area where you have uh, multiple sub offices that are open spaced, the recommendation is that you have a mask on while you're sitting down there, and that's the same that we have implemented in the health unit for all of our staff. So staff that have their own offices, as long as the doors are closed and they're within their own office, may remove their mask. Staff that are in an area where there's multiple kiosks close together and it's not enclosed, those staff are required to have mask on at all times.
Thank you. Okay. They'd also like information on how to go about supporting employees who qualify under phase 2 of the vaccine rollout to receive the vaccine. Does that make sense to you?
I'm not sure I understand the question. What support would they need?
Yes, it's qualifying under phase 2. I'm not familiar with phase 2, what that represents.
So there's different individuals in phase 1 and phase 2 that are eligible for the vaccine, but I'm not sure about how to answer the question with respect to how to support them. If an individual is qualifies under the phase 2 and they have an appointment, the way to support those individuals would be to allow them to go get the vaccine as an employer. I'm not sure if that answers the question. If the individual that asked the question is on online here, if I haven't answered it, if you can clarify.
Yes, actually, she is online. How do employees prove this, and do they need a letter?
Good question. I don't know if they need a letter from the health unit, or would that be the letter from the employer? I'm sorry, I'm just missing the question here.
I think, uh, Genevieve, if you could maybe answer, are you asking from an employee's perspective or from an employer's perspective?
From an employer's perspective,
Actually,
just from an employer's perspective, what can we do to support our employees? And just as we're getting ready for that second phase, because we feel we have some employees that would qualify, is there anything that we can do to support them or to advocate for them?
Okay, so my suggestion would be to promote the use of vaccination, and for your employees that meet that criteria to be vaccinated. The more people we can get vaccinated, the more immunity we have in our community, and hopefully the sooner we can get through it. So as an employer, by promoting the vaccination and allowing people to go get their vaccine when they're scheduled vaccine clinic or vaccine appointment is, would be probably the best way that an employer could support their staff.
Okay, thank you.
thank you. Okay, another question is everyone who enters the building required to have a face mask? As an example, eye protection.
So the eye protection is specifically required for staff, and it's specifically required for staff that are within 2 meters of an individual that's not masked, and there is no other barrier. So if you think about people that are working, cashiers that are working in stores, grocery stores, or any other stores, if they don't have the plexiglass between them and the client is one that falls within the exemption criteria, whether it's a medical exemption or one of the other allowed exemptions, then the staff individual is required to have a mask and a face shield. Now, this requirement came originally from Ministry of Labor, and Ministry of Labor is doing blitzes on various different businesses to ensure that there is compliance. It was originally initiated by Ministry of Labor and has since been adopted in the provincial regulation under Regulation 8220.
Okay. The next one, is it mandatory that the United Way make use of technology to inform people about measures to prevent the spread of COVID-19?
I wouldn't say it's mandatory, but it'd be greatly appreciated. Anytime we can have businesses, organizations provide support and accurate, good information to the general public, the message is getting out. So it's not mandatory, but it is good, and it's greatly appreciated by those that are working on the front lines.
Okay, so I think that basically answers the next question he had, was about the mandatory use of technology, social media messages, display screens, and websites for sharing messages with patrons on protective practices. It's not mandatory, but it would be appreciated.
Correct.
Okay. The next question I have submitted is, in a manufacturing facility closed to the public, screening questionnaire is completed daily, social distancing is respected, 6 people are working in a 7,900 square foot workspace. The work requires physical labor. Masks create difficulty breathing. Must masks be worn in this scenario?
So the way that the legislation is written, yes.
Okay, so regardless of the fact that it requires, I guess, physical exertion. a mask is still required.
Correct.
Okay. Next
You
question
also,
is,
let me just
are
go
all
back to that question.
manufacturers?
If I can just add in,
Sure.
staff in nursing homes, whether it's the PSWs or other staff in the kitchens, they're also physically working, moving the clients, working in hot environments, and they're required also to wear the masks. So it's just a different type of industry, but the requirement is the same.
Okay. Next is this, are all manufacturers required to be opened currently, as long as they are adhering to the safety rules regarding PPE, social distancing, worker/visitor screening, etc. They are not required to be manufacturing for an essential business. So I guess the question is, it's not an essential. Are all manufacturers allowed to be open, even though they're not essential businesses, but following all of the safety rules?
Unless the business or the manufacturer or is specifically identified as requiring to be closed in the regulation, they would be allowed to operate, but would need to operate with all restrictions that are imposed, all safety measures, like the personal protective equipment, like the mandatory screening on a daily basis, like having the COVID safety plan in place, and that goes on for every business, whether it's a manufacturer or any other business. So unless they've been specifically prohibited to operate or closed, then they're allowed to operate with restrictions.
Okay. And Linda, if you're on with us today, is that clear for you, or is there something else that you're hoping to hear? Okay, that's good. She says it's all clear. The next question, just what are some of the restrictions, or what, let me just read this again. Just want to hear what some of the restrictions are currently and going forward for any type of outdoor activity the Cobeconk Lions Club might hold in the future. What type of timeline are we looking at?
So timeline-wise, the current order, emergency order, is in place until February 11th. Restrictions-wise, there is, all special events are closed. So there's no special events that are allowed to be operating right now. The gathering limits outdoors is 5 individuals in a group. And if there's any specific questions, feel free to email the inspections at hkpr.on.ca email, and an inspector will be able to provide guidance as we move through this this pandemic. So hopefully we'll be out of the lockdown zone within the next month or so. And as we start reopening the province, there will be additional adjustments to the regulations that are reviewed by our staff on a daily basis. All of that information is provided to our call center and our inspectors, and then they're responding back to individuals that are posing specific questions.
Okay. This is, I guess, a bit of a repeat, but does 100% mask wearing indoors apply to all spaces in all organizations, i.e. single offices with closed doors?
No. And I think I've covered that. If you're in an office, we got to have some common sense here. The transmission of the virus is through droplets predominantly. There's been some evidence of some aerosolized matter, but predominantly it's droplet spread. The concern that we've seen is with the new variant of the virus coming from the UK. There's also been a couple other variants that have been recently identified from South Africa, one from Japan. So there is a need to be vigilant, but we need to use some common sense as well. If you're in an office by yourself and there's nobody else in there, you've screened yourself, and you're healthy and you haven't been in contact with anybody else that is a high risk contact or a case, there's no need for you to wear a mask in that office.
Okay. The last question I have here, I guess, is really around cottage rentals. Properly sanitized cottage rentals. Just reading through the question, is there a requirement to around, for sanitizing, the safest way for these summer rentals to occur? The cleaning techniques, and between rentals, and it was questions sort of about isolation for a week as well. I'm not really quite sure, but is there any comments that you can make about the cottage rental and the requirements of those that are planning to do so?
So cottage rentals are not allowed at this point unless they're utilized for essential workers or for emergency housing. Okay. Going forward into the summer, that's likely going to change, and there's going to be more than likely additional allowances made and the relaxing of some of the restrictions. So keep in mind that evidence has shown that the virus is viable up to about 72 hours on certain surfaces. So the cleaning and sanitizing of high touch surfaces is really important. So what are some of the high touch surfaces? Doorknobs, light fixtures, telephone, remote controls, microwaves, stoves, those are the areas, washrooms, those are the areas that you need to pay particular attention to. Also, if you have an individual that is in your cottage, once permitted to open, that is self-isolating because of them being either identified as a high-risk contact or a case, then laundering of your bed sheets, pillowcases, potentially pillows as well. So that aspect of things need to be taken into account as well.
Okay, those are all the questions that were submitted in advance. So I'm now into the chat box, and I'm going to go through them in the order that I see from the first, the first one in. So Melissa, BIA, small non-essential businesses would like clarification that they are allowed to be in their businesses during the day to provide curbside pickup. And there is no issue with their staff come up and go to their jobs to help. So I guess coming in, no issues having their staff come in to help and with the service.
That's the way that I understand the way that the legislation is written. So businesses that have not been specifically identified as ones that have to close are allowed to operate. So staff that need to travel to work to be able to provide whatever service they do, and the business is operating as curbside, are allowed to be able to go to work and then come back. it's recommended that the employer would provide some sort of a letter or something to their staff. For our staff, we'll have our designation cards. So if I get stopped by a bylaw officer or a police officer, I can show them that I'm traveling to my work, and then there is no question.
Okay. All righty. The next question we have here, and that's an interesting thing you just said, is did you say a designation card or a destination card for your travel? So
Not destination card, public health inspectors, and I'm talking about my staff.
Oh,
We have identification cards that identify as public health inspectors working for local public health unit under the authority of the medical officer of health. So that's what we use to show that we're on health unit business kind of thing.
but would you recognize that or recommend that a staff person be carrying some sort of, I guess, a document from their employer stating that they are working within the business during these restrictions, so that if they are pulled over?
I don't think it would hurt. There's nothing in the regulation requiring that. But if and to tell you the truth, our enforcement partners and ourselves, we don't have the authority to just pull people over willy-nilly to start asking for your identification.
Okay.
But if there is a reason for a stop, if you're speeding or if you roll a red light or roll a stop sign and the officer stops you and they look at your license and you're traveling, they may ask, why are you traveling? Or if individuals from a different area, they may ask what their business is traveling into the area.
Okay, very good. Thank you. Another question I have is, has the health unit received any information from the province as to when it comes time for the vaccine to be available locally, i.e. stage 2? Will it be administered by the health unit, the hospital, or local pharmacies?
That's an excellent question. We actually are working with our logistics team along with our municipal partners and local hospitals and long-term care facilities. Right now, we're planning for the phase 1, which is going to be the vaccination of all long-term care home staff and residents and hospital staff and emergency workers. So that's the focus right now. So we have been in communication with the province about vaccines that will be provided to HKPR Health Unit. I'm not on the logistics team, so I'm not the best person to comment on phase 2 or phase 3 of the vaccine rollout. I don't think we're there yet. I think we need to finalize the phase 1. Phase 1 is going to be happening through the local hospitals and long-term care facilities. So those are the facilities that are going to be doing the initial phase 1 vaccinations. Health unit might be involved in later phases, but that hasn't been finalized yet.
Okay, great. Thank you. The next question I have is, I guess it's again about the rental, cottage rentals. The remark is that does Ford not understand that the urban families will vacation regardless? And does he not understand that a properly cleaned cottage that supports the same family units is the safe way to provide a vacation? Do you have a remark on that?
Yes, and I think the premier really does understand all of the intricacies that are happening. He's not a dumb man. He's a very smart man, and he listens to what's happening around him. So what we're seeing, and we're seeing this in our own communities, is the unessential travel that is happening from the areas that are hardest hit and transmitting the virus into areas that have been generally spared by a significant amount of infections. And we are seeing those transmissions. So the whole idea of limiting travel interprovincially is to prevent the transmissions from areas in the province that are hardest hit to areas like City of Kawartha Lakes, Haliburton, Northumberland County, where people from the GTA have cottages and want to go to those cottages.
Can I jump
Until
in for
we
a
get
moment?
this, virus under control, and we have enough population vaccinated where we have significant amount of immunity in the community, I think premiers made a decision based on recommendations from the chief medical officer of health and the medical officer of health community to best place the province in a way that we can safely reopen sooner than later.
Can I jump in for a minute?
Sure.
This is Brian McKinley. Hello?
Yes, go ahead.
Hi.
Yeah, this is
Hello.
Brian McKinley. I'm the owner of Meridian Cottage Rentals out of Cobotown. That was my question. My point is that last year in 2020, when we were still in the midst of a severe COVID outbreak, I not only rented all my cottages completely and fully, which was legal at the time, but I turned down over 5,000 applicants from the GTA area. And I'm seeing the same response this year, even in January, for people looking to rent cottages. They are abjectly horrified about getting on a plane, a train, a bus, and they think that a family unit that lives together, that comes up and rents a properly sanitized cottage, is the safest way that they can keep their families safe, but yet still want to get out of the cement jungle that they live in for 51 weeks of the year. Does this not make sense that we allow people and teach them that you must stay on your property, bring all your goods up from the city, stay away from small towns, and enjoy the fruits of the Kawartha Lakes, because they're going to do it anyway, somehow, somewhere. I'd rather do it, I'm going to do it legally, but there's a lot of people out there who will do it not.
So thanks for your comment, then, Brian, and I do sympathize with our cottage industry partners. I've been speaking with all the resort owners and operators up in Haliburton, and there is a significant hit that our industries are taking currently, and I don't want to miss that point. This is significant, and it's impacting families, it's impacting business owners, and I just hope that we get through this sooner than later, because we can't continue to live like this for very long. So I completely sympathize with you, Brian, and anybody else that's involved. What I can say, though, is that I have personally seen people coming up to our areas that have, as soon as they got here, they received notification that they're either positive or they're a high-risk contact of a positive individual, putting not only people in our area at risk, but any other place where they stop to purchase fuel, purchase meals, especially in the summer when everything was open and we had indoor dining and everything else. So we have to really look at what is the point of the some of the strategies that have been implemented to prevent the transmission of this virus. And if we want to continue enjoying the cottages and our resorts and everything else. We got to do it safely and hopefully, like I said, we'll be able to get through this as soon as we have enough people vaccinated in the community to have that buffer.
But we don't see that transmission coming up from the urban centers to the city of Kawartha Lakes. We don't see that in the numbers.
Well, I would disagree with you there. And one thing to keep in mind, Brian, and anybody else that's on a call, the transmission that's reported in the HKPR, on the HKPR website, is only transmission of individuals that are living in our area. So if I get infected because my home address or address of residence is HKPR and falls under the HKPR jurisdiction, the HKPR health unit has to report it in their number of cases. We don't report people that are visiting our area in that number. So individuals that are coming into our area and are positive are being reported in their respective jurisdictions, whether it's Halton, Peel, Toronto, Windsor, Essex, Guelph, any other jurisdiction. So when you look at those numbers that we have on our website, keep that in mind.
Well, I served over 1,123 guests the summer of 2020 at all my cottages. And I will tell you that every last one of them understood the rules, that they bought all their supplies, they fueled up in the city, and that they drove straight to the cottage and stayed on the property. And in 1,123 individuals that arrived, not one response that I get back, for which I'm very diligent in asking, that there was an incident in which they passed on or had COVID at the time. So it seems to me that if there's a well-managed set of rules when it comes to cottage rentals, that makes better sense than just leaving it wild, wild west, which is the way that it seems right now for those who are not willing to play by the rules. Does that not make sense to you?
Yeah, I think we're just going in circles in here. I understand your position. I disagree with having, at this point, during the lockdown, with having people from other jurisdictions coming into an area until we get the COVID under control provincially.
Thank you for your time.
Okay, thank you, Brian. I have one last question up here. So if anybody has a question that's lingering, please put it into the chat box. Your time is now. So here we go. Looking ahead for next fall, this is Harry Stoddard. Has there been any discussion for what conditions will need to be for us to see the return of large gatherings? For example, the Lindsay X. Will vaccinations of the majority of the population be sufficient, or will other factors come into play?
Yeah, and that's an excellent question, Harry. Those are questions that, unfortunately, I don't have an answer for. These are policy questions or policy decisions that are made at the provincial level. And a lot can happen between now and the fall of 2021. So if we can get the number of cases under control, if we can get large volumes, a large number of our population in Ontario vaccinated, then there is a possibility that there's going to be more of a relaxing of restrictions. Generally, respiratory viruses are not. We don't see the infection transmission of respiratory viruses or respiratory infections during the summer months. So there is obviously an opportunity for us to have majority of the population vaccinated. The summer months, reducing the number of infections, and if all works well, there's a good possibility that we may see significant relaxing of the regulation. But once again, I'm not, I don't have that crystal ball, and I don't sit at those policy tables, and I don't think we're at that stage yet to be able to make those kind of decisions right now.
Okay. I just got a message from my puffer. Certainly, we would love to be able to hold these on a regular basis when there are other updates and changes. So just stay tuned, and as things do come up, we will try to accommodate. So that's the last of our questions, Richard. And I'd like to thank you very much for taking the time and sharing your insights with us today. It's truly appreciated. But I want to ask everybody if that before we go, your feedback on our webinar is appreciated. Providing valuable learning experiences that support our businesses in general is our priority. And I was wondering if we could take a moment to get you to complete a poll. It's 2 short questions regarding your experience today. And Jennifer's got the evaluation up right now. So please fill it in. It'll just take a moment as Jen's tabulating for us. Jen, give me a thumbs up when you're all done.
Just waiting. It's almost done.
So you're going to be
And
waiting for me because I'm not filling it in.
online, just to point it out again, this is being recorded, and once it's all done, we will save it and upload it to the City of Kawartha Lakes website.
Okay, we're done.
Okay, so that's us for today. This information we're going to be holding on to. Appreciate those who were able to participate and provide the feedback. Thank you again, everyone, for joining us. And I hope everyone enjoys the rest of their week. Bye for now.
Bye-bye. Dan, if you could send me the a copy of the recorded presentation as well, I'll just share it with my director as well. And also, if you could let me know what the results of that polls were, that'd be good too.
Okay, very
Any
good.
thoughts so far?
Jen, I think you can stop the recording now. I thought, no, that was great. I think it went well this